Hi, everyone. My name is Dr. Rita Roy, CEO at the National Spine Health Foundation, and I'm your host for the Get Back to It podcast, where we tell real stories of healing and recovery. What does it mean to get back to it? It means overcoming spinal conditions through treatments that work in order to return to the people and activities you love, whatever that looks like for you. It's time for a stretch break. I encourage you to stand, walk around, or do some simple stretches at your workspace while listening and find encouragement in this 5-minute story of hope. Ready? Your stretch break starts in 3, 2, 1. We're grateful that Nancy Kay is sharing her story with us so that others can learn from her experience. Nancy Kay is a spinal champion who experienced painful arthritis of the cervical spine, that means her neck. Nancy is a 63-year-old woman who had been having significant neck problems off and on for the past 15 years, stemming from a car accident she was in as a teenager. She had previously undergone a cervical fusion, which failed to incorporate properly at the C4-5 and C6-7 levels. She had pain, tingling, and numbness in both arms, as well as a burning feeling in her neck and shoulders, and difficulty with her balance. The pain in her neck caused Nancy to have disabling headaches. The pain was so severe that it bothered her almost every day. She found some relief by lying on her side, but essentially was unable to sleep at night due to the pain. Sitting at the computer and even sitting while watching TV were intolerable. Nancy does not have a family history of spinal disease, but she came with severe degenerative changes in her cervical spine. Non-surgical treatment options, including physical therapy, anti-inflammatory agents, massage, pain medications, and muscle relaxants, were not effective for her. Her neck x-rays showed reasonable posture. However, they also showed that she clearly had severe degenerative changes at the C4-5, C5-6, and C6-7 disc spaces. Nancy had x-rays done to show her range of motion, and these x-rays demonstrated that arthritis had essentially stiffened her spine, and the grinding arthritis pain was forming bone spurs, compressing both her spinal cord and the exiting nerve roots. Nancy's MRI scan showed similarly that disc herniations were compressing her spinal cord. Upon review of her studies, her surgeon recommended a revision surgery using bone morphogenetic protein, a special type of bone graft, to help better stabilize her spine and fix her failed fusion. The fusion was a success. She was clearly on the road to recovery and becoming pain-free. We applaud Nancy's efforts in dealing with her condition and not letting the first surgery be the end of her story. Stories like this remind us that the road to healing and recovery is a journey that sometimes involves a step back in order to keep moving forward. The lesson is, don't give up. Most of the time, there are solutions to help. At the National Spine Health Foundation, something we believe in most is providing hope for recovery through sharing stories of success. It isn't always easy to find someone to relate to, even though 100 million Americans suffer from neck or low back pain each year. To hear more stories of recovery and access educational materials about spine health, visit us at spinehealth.org. If you're interested in supporting our show financially, you can contribute at the link provided. Thank you for listening.